Hello, I'm Dr. Alan Mercer. If you're watching this at 2 in the morning because you just got back from the bathroom for the second or third time tonight, I want you to know something right away. You are not broken, and you are far from alone. In my 35 years of family medicine, this is one of the most common concerns men over 60 bring to my office, and yet almost nobody talks about it openly. So let's talk about it, honestly and calmly, the way I would if you were sitting across from me right now. The medical term for this is nocturia, which simply means waking up at night to urinate. And here's the first thing I want you to understand. Waking up once, maybe even twice, in the middle of the night to empty your bladder is actually considered within the range of normal for a man over 60. Your body changes as you age, and some of that change happens to your bladder and your kidneys. So if you're getting up once or twice and you're falling back asleep easily afterward, that alone is usually not a red flag. But if you're getting up 3, 4, 5 times a night, if it's disrupting your sleep so badly you're exhausted the next day, or if it's a new pattern that's suddenly gotten worse, that's when it's worth understanding why and worth talking to your doctor about it. Let's walk through the reasons this happens, because there isn't just one cause. There are actually several different systems in your body that can be behind this, and figuring out which one is affecting you is really the whole point of a good medical evaluation. Let's start with the one most men have heard of, an enlarged prostate, which we call BPH, benign prostatic hyperplasia. Your prostate is a small gland that sits right at the base of your bladder, wrapped around the tube that carries urine out of your body. As men age, that gland tends to grow larger. It's not cancer, and it's extremely common. By the time a man reaches his 60s, more than half will have some degree of prostate enlargement. The problem is, as that gland grows, it can squeeze the tube it surrounds like a fist slowly closing around a garden hose. That means your bladder has to work harder to push urine out, it may not empty completely, and it fills up again faster than it used to. So you're waking up not because your body is producing more urine, but because your bladder simply can't hold as much before it sends that signal to your brain. Now, a different but related issue is something called overactive bladder. This is not about the prostate blocking the flow. This is about the bladder muscle itself becoming, in a sense, overly sensitive or twitchy. The bladder wall has a muscle called the detrusor, and normally it stays relaxed while the bladder slowly fills, then contracts when you're ready to urinate. With overactive bladder, that muscle starts contracting before the bladder is actually full, giving you a sudden, sometimes urgent sensation to go, even when there isn't much urine there yet. This can happen alongside BPH or completely separately from it. Then there's diabetes, and this one surprises a lot of men. When blood sugar runs high, your kidneys try to help by pulling extra glucose out of your blood and pushing it into your urine. But sugar pulls water along with it, almost like a sponge effect, so your body produces more urine than usual, a condition we call polyuria. If you're waking up frequently at night and you also notice you're thirstier than usual, or you've had unexplained weight changes, that combination is worth mentioning to your doctor because it could point toward blood sugar that needs to be checked. Sleep apnea is another cause that's often overlooked because people don't connect breathing problems with bathroom trips. But here's the connection. When your breathing is repeatedly interrupted during sleep, your body experiences stress responses that affect a hormone called atrial natriuretic peptide, which in turn signals your kidneys to produce more urine. On top of that, sleep apnea fragments your sleep so severely that you're already waking up frequently for other reasons, and using the bathroom becomes almost a convenient explanation for a wake-up that was actually caused by your airway. If you snore loudly, if your spouse has mentioned you stop breathing for moments during the night, or if you wake up feeling like you never really rested, that's worth bringing up specifically. Heart disease and heart failure are also connected to this symptom, and this is an important one not to dismiss. During the day when you're upright and active, fluid can accumulate in your legs, especially if your heart isn't pumping as efficiently as it once did. When you lie down at night, that fluid redistributes, moving back into your bloodstream and eventually to your kidneys, which then produce more urine. This is called nocturnal polyuria related to fluid redistribution, and it's a completely different mechanism than a prostate or bladder problem. If you've noticed swelling in your ankles or legs during the day, shortness of breath when lying flat, or unusual fatigue, these are the kinds of details your doctor needs to hear. Kidney disease can play a role as well. Healthy kidneys are able to concentrate urine efficiently, especially at night, which is one of the reasons your body naturally produces less urine while you sleep. When kidney function declines, that concentrating ability weakens, and the kidneys may produce more dilute urine around the clock, including overnight. This is often silent in its early stages, which is exactly why routine blood and urine testing during checkups matters so much, even when you feel fine. Now let's talk about the everyday factors, because these matter just as much as the medical ones, and often they're the easiest to address. Evening hydration is a big one. If you're drinking large amounts of fluid in the 2 to 3 hours before bed, your kidneys are going to be processing that fluid right around the time you're trying to sleep. I'm not telling you to stop hydrating. Hydration is important for your health, but shifting the timing, drinking more earlier in the day, and tapering off in the evening can make a real difference. Caffeine is another factor, and it works two ways against you. First, it's a mild diuretic, meaning it increases urine production. Second, it can act as a bladder irritant, making the bladder more sensitive and prone to those overactive contractions I mentioned earlier. That afternoon, coffee or evening tea might be part of the pattern. Alcohol has a similar dual effect. It suppresses a hormone called antidiuretic hormone, which normally tells your kidneys to conserve water at night. Without enough of that hormone circulating, your kidneys let more water pass through as urine. Combine that with alcohol's tendency to irritate the bladder, and an evening drink can translate directly into a 2 a.m. wake-up. Prescription diuretics are worth mentioning specifically because many men over 60 are on these medications for blood pressure or heart conditions. If you're taking a water pill in the evening, it may still be active in your system well into the night. I want to be very clear here. If you're on a diuretic prescribed by your doctor, do not stop or adjust that medication on your own. But do mention the timing of your nighttime bathroom trips to your physician, because sometimes simply adjusting when you take that medication, taking it earlier in the day, can meaningfully reduce nighttime urination without changing the dose or the treatment itself. Then there's the natural aging of the bladder. As we get older, the bladder wall can become less elastic, meaning it doesn't stretch and hold as much volume as it once did. The muscle can also become slightly weaker in its ability to fully empty. And separately, your body's production of that antidiuretic hormone I mentioned tends to decline with age, which means your kidneys produce relatively more urine at night compared to when you were younger. This is simply part of the aging process for many men, not a disease in itself, but it does explain why an occasional nighttime trip becomes more common as the decades go by. Let me tell you about two patients, because I think their stories illustrate just how different the underlying causes can be, even when the symptom looks identical on the surface. The first was a gentleman named Robert, 68 years old, a retired high school teacher. He came to see me because he was waking up 4 times a night, and it had been getting worse over about 8 months. He told me that when he did urinate, the stream felt weak. It took him a while to get started, and he never quite felt like his bladder was empty afterward. During the day, he found himself needing to go more frequently too, and occasionally felt a sudden urge that was hard to control. Based on his symptoms, I examined him and ordered some basic tests, including a PSA blood test and a review of his urinary flow. What we found was a significantly enlarged prostate consistent with BPH. There was no cancer involved, which was a relief to him, but the enlargement was substantial enough to explain his symptoms clearly. We discussed treatment options, starting with a medication that helps relax the muscle tissue around the prostate to ease the flow. Over the following months, working closely with his urologist, Robert's nighttime trips decreased and his daytime symptoms improved as well. His case is a good example of how a mechanical issue, the prostate physically restricting flow, can be identified and addressed through proper evaluation. The second patient was Harold, 74 years old, a retired accountant. His story was quite different. He was waking up 3 to 4 times a night as well, but when I asked more questions, some other details emerged. His wife had mentioned that he snored heavily and that she sometimes heard him gasp or stop breathing briefly during the night. Harold also mentioned he'd been feeling unusually tired during the day, even after what he thought was a full night's sleep. His legs would sometimes swell slightly by the end of the day, too. Given this combination, I referred him for a sleep study, and it turned out Harold had moderate obstructive sleep apnea. We also checked his heart function given the leg swelling, and while his heart was working reasonably well, we identified some early signs worth monitoring closely with his cardiologist. Harold began treatment for his sleep apnea with a CPAP machine, and over time, both his sleep quality and his nighttime bathroom trips improved. His case shows how a breathing disorder, something that doesn't sound related to the bladder at all, can actually be a major driver of nighttime urination. I want to be clear, I'm not sharing these stories so that you diagnose yourself sitting there watching this video. Every man's situation is different, and only a proper evaluation with your own physician, examining your own history and your own body, can tell you what's actually going on for you. What these stories do show is why it matters to have this conversation with your doctor rather than just assuming it's simply an aging bladder, or on the other end, assuming the worst without any evidence. So let's talk about what you can actually do, starting with the lifestyle adjustments that are supported by good evidence and are completely safe to try on your own, regardless of the underlying cause. Consider shifting most of your fluid intake earlier in the day and reducing what you drink in the 2 to 3 hours before bedtime. This doesn't mean restricting fluids overall. Staying well hydrated during the day is still important for your kidney health and your overall health. Pay attention to caffeine and alcohol, particularly in the evening hours. You don't necessarily need to eliminate them entirely, but noticing how your evening choices correlate with your nighttime symptoms can be genuinely revealing. Some men find that simply moving their last cup of coffee to before noon makes a noticeable difference. If you have swelling in your legs during the day, elevating your legs for a period in the late afternoon can help your body process that excess fluid before bedtime rather than after you lie down. Some physicians also recommend compression stockings during the day for men who deal with this regularly, though that's a conversation to have with your own doctor based on your specific situation. Keep a simple log for a week or two, just jotting down what time you drink fluids, what you're drinking, and what time you wake up to urinate. This kind of pattern tracking is incredibly useful information to bring to your doctor's appointment, and it often reveals patterns you hadn't noticed yourself. And of course, maintain the basic pillars of good sleep, a cool, dark, quiet bedroom, a consistent bedtime, and limiting screen time before sleep. Better overall sleep quality can sometimes reduce how disruptive these nighttime wake-ups feel, even if the frequency doesn't change dramatically right away. Now, when should you actually pick up the phone and schedule an appointment rather than just trying these adjustments on your own? I'd encourage you to see your doctor if you're waking up 3 or more times a night on a regular basis, if this represents a real change from your normal pattern, if you're noticing a weak urine stream, difficulty starting, or a feeling of incomplete emptying, if you're experiencing increased thirst or unexplained fatigue alongside this, if you have leg swelling or shortness of breath when lying flat, if your spouse or partner has noticed breathing irregularities during your sleep, or if this is affecting your quality of life and your energy during the day. None of these symptoms on their own mean something serious is definitely happening, but they are the kinds of details that help your physician figure out which of these several possible causes is the one actually affecting you. I also want to gently mention, if you ever notice blood in your urine, pain during urination, fever, or sudden inability to urinate at all, those situations warrant prompt medical attention rather than waiting for a routine appointment. I know it can feel a little embarrassing to bring up bathroom habits with your doctor. Believe me, after 35 years, I promise you there is nothing you can tell me about your bladder that I haven't heard many times before. This is simply part of taking care of your body as it changes, the same as we'd address a change in blood pressure or cholesterol. Your doctor would genuinely rather hear about this now and help you figure out what's going on than have you quietly lose sleep for months or years, assuming it's just something you have to live with. If this video helped you understand your own situation a little better, I'd really encourage you to subscribe to the channel. We cover topics just like this one regularly, the kinds of health questions men our age often wonder about but don't always get straight answers to. And if you've had your own experience with this, whether it turned out to be your prostate, your sleep, or something else entirely, I'd genuinely love to hear about it in the comments. Sharing what worked for you or what you learned along the way might be exactly what helps another man watching feel less alone with this tonight. I'm Dr. Alan Mercer. Thank you for watching, and I'll see you in the next video.